It's Mari McInerney from Croaky, and we're here at the Safer Care Victoria annual conference here on health, safety and quality. And I have Ben here who has just led a really great session on cultural safety and can introduce himself far better than I. Can you do that for us, Ben?
Thank you. So Ben Gorrie is my name. I'm an Aboriginal man from Victoria here, Gunai Kurnai mob, which is based down in East Gippsland there. So my grandparents and parents were from the Lake Tyers Aboriginal Trust. It's been brilliant to present here today at the Safer Care Victoria Giant Steps Conference. My presentation was more about how cultural safety saves lives, and it's actually an integral part of creating a safer, effective, high-quality health system. And it's it's one thing that's kind of forgotten largely amongst health services. So
forgotten?
Well, either ignored or too hard, or yeah. So I think it's personally, I think it's as equally important as making sure there's medication safety or safety around administration of blood products, for example, or ratios of nurses to patients. I think it's right up there with things that really directly impact the care that's given, and especially for the people who need the most care, which is, research shows us, which is Aboriginal people.
Tell us why it's up there with those things.
Well, it's up there because it's an all-round system-wide problem that we have. There's a lot of research that shows that it's the systems that are not culturally safe, which impact people having quality care, accessing services. So that's where it's really important to make sure that the whole systems are safe there, so our people can go there and receive good quality care. Part of that as well is making sure that it's a nice system for our health professionals to work in as well, though. So if you have a good number of Aboriginal health professionals within these systems, they actually translate into better quality care for Aboriginal people, but also there's the other implications within those Aboriginal health professionals, which gives them some financial security, improves health literacy for the family, and provides a lot of pathways and opportunities that otherwise wouldn't be there.
Fantastic. Now you rolled out 4 main points, but before we get to them, one of the things that came up a couple of times in the session was the difference between cultural awareness training and cultural safety. Can you just run through that?
Yeah, so cultural awareness training is something that's been historically the norm, really. Where cultural awareness training, it's a really easy, comfortable process for people who are under the dominant culture to undertake, because what it does, it kind of examines Aboriginal people, and we look at them, people look at them and say, this is what an Aboriginal person is. It kind of has its place to an extent in terms of knowing your local community, who it is around your health service, but what I think really people need to do is go further and actually do cultural safety training, where cultural safety training actually examines the dominant culture, examine the person's own beliefs, assumptions, what drives them, where they fit into the world as well, and how their beliefs and assumptions and attitudes actually transform into healthcare as well.
And how might, if somebody did that, if somebody applied that lens to themselves towards cultural safety, what sorts of questions would they be asking themselves? Yeah,
it'll be really sort of what makes me, where do I derive my values and beliefs from, and how does that impact on the care that I give and what I think of others there. So it really, really encourages people to critically examine themselves and understand the power difference between the dominant culture and the non-dominant culture.
And you said that applies also to other communities who experience harmful care.
I think the solutions are the same, really, because we look at those other communities as well, such as any other issue. So granted, I'm Aboriginal, so I can really speak on behalf of Aboriginal and Torres Strait Islander healthcare, but there may be the similarities between either gender or other races or sexuality as well, though, where I think it really is the same sort of solutions, which is that cultural safety, because it's a power imbalance once again there, and like I said, it really encourages people to critically analyse that difference in the power.
Fantastic. Now, Ben, you did your 4 points that you presented on,
yep.
And you said it would be fantastic if all 4 of them were in
Absolutely.
effect, but even some of them in various combinations.
Yeah, listen, if 4 points were cultural safety, making sure that you have a cultural safe workplace, improving the workforce, so developing the Aboriginal workforce, being explicitly anti-racist as well, and also developing strong, respectful partnerships as well there. So even if health services just did a couple of all those 4, that is still steps in the right direction to improving the health care and saving lives, really. It would be amazing if all 4 were done, but they're just a few examples that I was happy to share along with our participants today.
You gave a few examples too of where the system just doesn't actually take it into account. And you were talking about anti-racism as a training and a strategy in workplaces. What was your point there?
Yeah, so being explicitly and proactively anti-racist is a big thing that I think is need to happen. I see in my personal experience, and I think it's shared across most of the people in the room actually, that one step to do that is actually having some policy, procedure, some strategy around how this health service can be anti-racist. I look into a lot of policies and procedures and I don't see actually anything mentioned there at all. So there needs to be investigation within health service organisations. What can be done to eradicate racism? How can that be reported? What are the reporting lines? What are the procedures around dealing with the report as well? And how does that encompass the reports from patients and health professionals as well?
Fantastic. And just in terms of partnerships, that was really interesting too, because you said there's a lot of tick the box stuff happening.
Yeah, unfortunately there's a lot of that tick the box, or having just some MOUs signed, and on paper it looks really good that we've engaged with the local Aboriginal community or this organisation or something, but really I think those relationships need to be meaningful and actually be respectful as well though. Sometimes some of those relationships are just in paper and not really worth the ink that it's written on the paper with. Some of them can even go too far about really overburdening that community or people or organisations as well. So it has to be a nice medium there that there's benefits from both sides as well though. And if you haven't got any relationships, investigate and build them up. If you do, strengthen them, maintain them, analyse where you are at them. Are we both getting benefits, or are we getting more than you type thing? Yeah.
You got a lot of questions in the session really of, what should I do? How do I stand up? And especially, that there's a power differential in the workplace as well, that some people would have to tell off seniors and they're not comfortable doing that. What advice do you give?
Absolutely, yeah. So there was one question that came from a clinician was about, because I set the challenge to the audience members, I said be proactive in cancelling out racism, call it out. When you see it, call it out. And the question was, well, how do we do that? What are some strengths for doing that there? Because I personally myself sometimes find it quite difficult to call that out myself, yet here I am telling everyone else. So it actually made me reflect a little bit too on what are some strategies that people can employ there. And you mentioned there are some power differentials within the professions as well though. A junior clinician will probably not speak up against a senior clinician as well though. So we went through some strategies as the group there, but one thing that stood out was maybe utilising some of the crisis resource management strategies there. So actually asking them, hey, so what did you mean by what you said there? Actually, can you explain what you meant there? And maybe in the hope that it'll actually get the person who has said something racist, who has done something racist, whether explicitly or implicitly, will actually reflect and analyse and say, well, what did I actually say? Oh, maybe I shouldn't have said something like that. So that was one strategy that we came up with though, but I think it really depends on where you are within your organisations, where you are within your education and level of sphere of influence as well about what you can do. And I think people just need to work on their own little ways to arm themselves, to have stuff in their toolkit already for when they do see it, so they're not so confronted, they can immediately call it out.
Fantastic. Anything else that you would like to say, Ben?
No, I just think it's been really, really positive, the amount of engagement that I've had today, and that people really are out there trying to make a difference, and it's just a matter of where to go to guide them and make sure they're doing the right thing. So there was two big points I made, that we do have that in terms of who to judge when places are culturally safe. Now, who judges that? Usually we have a lot of the experiences, the actual health service themselves actually assess themselves on how good they are, whereas we actually need the partnerships, we need the consumers, we need the people who are receiving care to make the determination of are you culturally safe or not. So we need that consumer engagement. And the other thing we need to make sure is that we engage with our peaks. So we've got 4 peak bodies that represent Aboriginal and Torres Strait Islander health nationally. We've got ourselves, so I'm a director on CATSINaM, the Congress of Aboriginal and Torres Strait Islander Nurses and Midwives. We've got AIDA, the Australian Indigenous Doctors Association, NATSIWA, the National Aboriginal and Torres Strait Islander Health Workforce Association, and IHA, the Indigenous Allied Health Australia. So we've got 4 peaks there operating in this space, and we can help out and direct and guide.
Fantastic. Thank you very much for your time on a very warm day here.